I'm Laura Oddie, the administrator for Bluegrass Specialty Surgery Center in Lexington, Kentucky. We have recently made dramatic changes in how we are approaching the COVID virus. First of all, we have hired a patient liaison. This person is the concierge for our center. What this means is you will be met at the car, your temperature will be taken, a list of questions will be asked, but then above and beyond that, your family will be notified every hour of your change in condition, how well you're doing in the surgery center, and what position you are in the surgery center. And what I mean by that is your loved one in pre-op? Are they in PACU? Are they in the operating room? We have taken one step further. This patient liaison, or concierge as we like to call her, will also be attending to the needs of your family. Should they need a cup of coffee, if there's something that we can do for them to make their stay a little bit more pleasant. Because during this time, we are not allowing visitors in the surgery center due to the CDC guidelines. Thank you, and we look forward to welcoming you at our center.
Welcome. My name is Melinda. I'm one of the registered nurses here at Bluegrass Specialty Surgery Center. I'm also one of the pre-op coordinators. Thank you for choosing us for your total joint replacement surgery. This class is designed to give you the important information you need to achieve the best possible outcome from your total joint replacement surgery. When your surgery is scheduled with your surgeon's office, you will be given a blue folder from the office. Inside of this folder, you will find a total joint replacement surgery guide. It's important for you to look at your information in your folder as early as possible. Inside of your folder, you will find several checklists that you will need to look at as soon as possible. These checklists have important information for you to know to be able to better prepare for your surgery. Also inside of your folder, you will find information to be able to log on to simpleadmit.com. This is a login site that you will use to enter in your health information for the pre-op coordinators. It is important for you to complete your health registration on Simple Admit as soon as possible. After you have entered your information, you will be receiving a phone call from one of the pre-op coordinators to review your medical history, discuss any questions that you may have, and also at that time she will be reviewing your medications with you and informing you of any medications that you need to stop for your surgery, any medications that you may also need to bring on the day of your surgery. There are things that you will be able to do to help prepare for your surgery, to help achieve the best outcome from your surgery. One of the things that we recommend that you do is exercising before surgery. This will improve your strength, your range of motion, and your endurance. You may ask your surgeon's office for a referral for PT for a pre-op visit, or also in your surgery guide from the office, there is also a list of exercises complete with pictures and diagrams that you can do at home as well. It's important to have adequate and proper nutrition and diet before your surgery. It's important for you to drink plenty of fluids, stay well hydrated, especially with water in the days before surgery. It's important to have a balanced diet. You want to eat a diet that is high in fiber to prevent post-op complications such as constipation. It's also important to eat a diet that's high in protein. This will aid in your wound healing. A few suggestions to have at home for the days after surgery: protein bars, protein drinks. These are excellent sources of extra protein to have in your diet. We would like for you to eat light on the day before your surgery. This will also help prevent constipation after surgery, and it also will help to reduce your risk for post-op nausea. Smoking is another thing that we would like to suggest for you to try your best to refrain from in the days before surgery. Any day that you can abstain from smoking in the days before surgery will help reduce your risks of complications. Smoking can cause breathing problems, increase the risk for medical complications such as strokes, heart attacks, respiratory failure. It also increases the risk for your infection post-operatively and for blood clots post-operatively. Please be sure that you do not smoke after 10 p.m. the night before surgery or on the day of surgery. But again, any day that you can abstain from smoking in the days leading to your surgery, the day of surgery, and the days after your surgery will significantly decrease your risk for those complications. Also, it is important for you to be honest with your healthcare providers regarding your alcohol intake. It is important that you not have any alcohol after 6 p.m. the night before your surgery. Also, you will find in your surgery guide folder from the office, you will find a guide for medications that do need to be stopped prior to surgery. There is a very specific list in your guide that you will find. There are such medicines such as blood thinners, herbal supplements and vitamins, hormone replacement therapy, medicines such as stimulants used for conditions such as ADHD, and diet pills. These medications should be stopped anywhere from 5 to 10 days, some of the medicines 4 weeks. So it's important to look at this list early as possible preoperatively. Additionally, there are measures that you can take at home before surgery to help prepare for your surgery. Setting up your home before surgery will help to keep you safe when you do return and make life easier for you as well. It is very important the first week that you are home to avoid falls. There are certain things that we would like for you to do ahead of time to help prevent falls. It is important to declutter your home in the days before surgery. Also, if you can clear a pathway. Initially after surgery, all patients with total joint replacement will be going home with a use of a walker. It is important to clear a path from your bedroom to your kitchen to your bathroom. Watch out for electrical cords and cords from like chargers and laptops, fans, heaters, those type of cords. Also, the little rugs that we have in our kitchens and bathrooms, the little throw rugs, it's a good idea to just put those away temporarily. Those create hazards as well for falls. Another thing that you need to think about at home is where you're going to be spending most of your time. We don't want you just laying in bed, of course. We want you up and about, and you'll want to find a good chair for home. It is important that you have a chair that is firm, with a firm back, and armrest to help you to raise yourself up and down from the chair. We don't want you to use a chair that has a soft cushion, something with firm. If you need to place a cushion or a folded blanket in the chair to help with that, that would be ideal. We would also like for you to sit in chairs that your knees are lower than your hips. We would also like you to avoid sitting in chairs that roll. Another thing we'd like for you to think about is if you have pets at home. You will need extra help at home caring for your pets during this time, during your recovery phase. You may want to also think about boarding your pets initially for a few days when you're first home from surgery. Again, small pets can cause hazards for falls. It's a good idea to place items in your home that you'll be using frequently, such as your bathroom items, your kitchen items. Place those within easy reach for you. We don't want you to be bending over, stretching, trying to reach things. It's also a very good idea to keep your cell phone or a portable phone with you at all times during the first few days that you are home. It's important that you have clean linens on your bed the night before surgery. It's also a good idea to have a week or two worth of laundry done so that there's plenty of clean clothing and that laundry is not something that you are having to worry about at home. We would like for you to avoid yard work for 2 weeks before surgery and also no yard work for 4 weeks after your surgery. The reason that we don't want you to do the yard work, and it's important not to do the yard work before your surgery, is we don't want you to run the risk of getting any cuts in your skin. Any kind of cut in your skin will just cause a little invitation for bacteria, which could cause a means for infection in your body. And we don't want to have any type of infection brewing in your body at the time of surgery. This is something that also could postpone or cancel your surgery on the day of surgery. You will need to arrange for help with your meals for after surgery. It's also a good idea to stock up on non-perishable food items and frozen food items from the grocery store. You may even want to make homemade dinners and have frozen available for your use for after surgery. There are a few items that you will need to purchase in order to prepare for your surgery. The first being a soap that is called Hibiclens. Hibiclens is a soap that you can purchase over the counter at a drugstore or pharmacy. You will need to only buy the smallest bottle that's offered. You can buy the store brand. If you need help locating that in the store, any pharmacist can help you with that. We will be talking how to use the Hibiclens later in this video. Another item that you will need to have at home is a box of Glad Press and Seal. You can find this in your local grocery store. This is something that you'll be covering your dressings with initially post-operatively for showers. It's a good idea to have a few extra dressings and surgical tape at home in case that you should need to change your dressing, in case that you have any bleeding in your dressing. It's a good idea to have a few of those you can buy at the drugstore as well. Another item that you may want to purchase for use at home for yourself as well as your caregiver is a bottle of hand sanitizer or antimicrobial soap such as Dial soap. It's important to always wash your hands well and keep your hands clean during this time to help prevent post-op infection. If at any time that you have in the days before surgery that you should have a rash or any cuts in your skin, any sores on your skin, at the operative site, it's important to notify Bluegrass Specialty Surgery Center as soon as possible or your surgeon's office. This could affect your surgery. There are several things that you will need to do at home in the day before surgery to help prevent infection. The night before surgery, we would like for you to use the Hibiclens soap in the shower. The night before surgery, you'll get in the shower, wash your face, private area, and your hair with just normal soap and shampoo. Then we would like for you to get a clean washcloth, use Hibiclens on that, and you will scrub from the neck down, avoiding the private area. Once you've completed that, you will lay that washcloth down and get a second clean washcloth. Use Hibiclens again. This time you want to use the washcloth on the surgical site. You want to leave the Hibiclens on the site for 3 to 5 minutes. Afterwards, you will need to towel dry with a clean towel, and you'll want to use no lotions, creams, body sprays on your skin. It is okay to use light deodorant. Afterward, you want to place freshly washed clothing on, pajamas, your gown, whatever you're most comfortable to sleep in that night. And also you will want to have clean, freshly washed sheets on your bed that evening. We do ask that you not sleep with any pets in your bed the night before surgery or after surgery as well until your incision is well healed and scabbed over. This is a good means to prevent post-op infection. Ladies, we would like for you to remove all nail polish. On the day of surgery, we would like for you not to wear makeup, any face creams or lotions. Men, no aftershave. Also, the night before surgery, we would like you to take 1,000 milligrams of Tylenol at 5 p.m. Again, this is the night before surgery. 1,000 milligrams of Tylenol at 5 p.m. and then repeat that again 4 hours later or at your bedtime. If your bedtime is after 10 p.m., you may take the Tylenol with a small sip of water, enough to get that down. The night before surgery, we would not like you to have anything at all to eat or drink after 10 p.m. No gum, no mints, no water, hard candy. The day of your surgery, it is okay to brush your teeth. Just be careful not to swallow any water. Also, the night before surgery, it's a good idea to get a good night's sleep. There are several durable medical equipment pieces that you will need for after surgery. You will need a walker for use after surgery. If you have access to a walker, you will need to have that in the car available in case you need to stop emergently on the way home after your surgery. You do not need to bring your walker into the surgery center on the day of surgery. You will need a walker, a standard walker, not a walker that has the seat, or called a rollator walker for safety reasons. If you do not have access to a walker, we can arrange for you to have a walker at the surgery center to take home with you on the day of surgery This will be through your insurance, and they will pay for a durable medical equipment piece once every 6 years. So please hang on to your walker for future use. You also need to think about if you would need an elevated toilet seat, bedside commode, or a shower chair for use at home. Especially with the hip patients, it's problematic to lower yourself down onto your commode at home if it's very low. If you have a newer commode that's higher, chair height, it's not as difficult. It is helpful at sometimes though to have the bedside commodes, just to have it bedside with you during the nighttime, and then during the day you can take those and use those over your regular commode seat. Another thing to think about is a shower chair. You may need help from this with getting in and out of your shower or in and out of your tub. You will be required to shower only, no tub baths, for some time after surgery until your wound is healed. So dependent upon your situation at home, it's a good idea to think about if you could possibly need a shower chair. The shower chairs and toilet seats, risers, and commodes we do not provide at Bluegrass Surgery Center, but you can get those at places such as your durable medical supply stores, Walmart, Lowe's, any drugstore and pharmacy carry those now. There are 2 pieces of equipment that we have available at Bluegrass Specialty Surgery Center that are available for purchase. They are optional items. If you have access to a Polar Care ice machine, you do not need to bring it on the day of surgery. Just have it ready to go when you get home. A Polar Care ice machine is something that we do offer at Bluegrass Specialty Surgery Center that is for sale. It's important to do a lot of icing and elevation after surgery. This will help reduce your swelling, which will in turn help reduce your post-op pain. One item that we have is the Polar Care ice machine. This machine is available to purchase on the day of surgery. It is $150. It's not covered by your insurance company. If you have access to this from another family member or previous surgery, that is fine. Clean that, get that ready to go at home. You do not need to bring this on the day of your surgery. If you choose to purchase this, we can purchase this inside on the day of your surgery when your family comes in to do the discharge instructions. This is $150. It is not covered by insurance. It is an optional item for you. If you purchase the ice machine, you also will be giving something called zero bone foam. This is the device that is used for elevation purposes. Your foot simply slides into the footrest, and this will enable your leg to remain straight, nothing behind the knee. You may want to use a pillow underneath of the zero bone foam to help provide additional elevation. So both of these items are available here for the day of surgery for purchase. They are optional. If you choose not to purchase the Polar Care ice machine, we will send you home with a regular ice pack, or you can buy the frozen, the gel packs to freeze in your freezer at home. On the morning of your surgery, before you come to Bluegrass Specialty Surgery Center, you will need to repeat the HIPAA scrub again, the same way that you did on the evening before your surgery. Place clean clothes on afterwards. You want to wear something to the surgery center that's going to be loose and comfortable, easy for you to get on over your dressing. For knee patients, regular pants, you'll have difficulty getting those on, so something very loose, shorts, sweatpants, such as that, is usually best. On the day of surgery, you will be asked to remove all of your clothing prior to surgery and put a hospital gown on. You also will be asked to remove contact lens, glasses, and hearing aids prior to surgery. We feel it is best if you do not wear your contact lens to the surgery center on the day of surgery. However, if you do, be sure you bring a case and your solution that you will need. We do ask that you not bring any valuables on the day of surgery, not wear any jewelry. Your clothing will be kept in your pre-op room on the day of surgery, but it is not locked. On the day of surgery, when you arrive at Bluegrass Specialty Surgery Center, you will, after registration process, you will be greeted by a registered nurse in the pre-op area who will do your pre-admission workup. This will consist of signing consent forms, verifying your surgical site, verifying that you have not had anything to eat or drink after 10 p.m. the night before surgery, verifying what medications you have taken. You will also have an IV placed for sedation purposes. At some point, you will be talking with your surgeon, who will be also verifying the site and marking his initials at your site, as well as you will be marking your site with your initials, so that everyone is agreeable that we have the correct site and the correct side. You also will be talking with an anesthesiologist on the day of surgery. He or she will be discussing your medical history, reviewing risks and benefits of anesthesia, and possibly doing what's called a peripheral nerve block. Also on the day of surgery, if you wear a CPAP machine or BiPAP machine or any type of dental device for sleep apnea, we do require that you bring those devices and equipment inside on the day of your surgery. Also bring any medication that the pre-op coordinator nurse has asked you to bring with you on the day of surgery. Also prior to surgery, you will meet with an anesthesiologist who will discuss your medical history with you, as well as discuss anesthesia risks and benefits with you. Dependent upon the surgery that you have, you will be offered a peripheral nerve block. The reason for the peripheral nerve block is a numbing procedure that is done in the pre-op area by an anesthesiologist. It consists of a single injection. For knee patients, it is typically in the mid-thigh area. It uses ultrasound to locate the bundle of nerves that control the pain on the top part of your knee. This procedure does not deaden your leg. We want you to be able to move and walk after surgery. It only affects the nerve bundles that control the pain on the top part of your knee. This procedure will not eliminate your post-op pain, but it will significantly decrease the amount of pain that you have post-operatively. Additionally, if you so choose, you may also go home with a Nimbus pain pump. You will be receiving a phone call in the days ahead of surgery from the Nimbus company explaining their pain pump, provided with a video to watch to view how the pain pump works. You will also be provided with written instructions of numbers to contact in case there are any problems once you arrive home. The pump will be connected after surgery and just before discharge. The peripheral nerve block will consist of a single injection. After this is done, there will be a small catheter left in your leg, mid-thigh area. Catheter, I'm saying, is about the size of a piece of dental floss. This will be taped down to your leg, and then just prior to discharge, this will be connected to the pain pump that you will take home in a fanny pack type situation or a shoulder strap that you will carry with you at home. This will last for 3 days. You'll get a slow, continual infusion of the local anesthetic for 3 days. This will not eliminate all of your pain. You will still need to take your oral narcotics that you will be sent home with. But it does help to significantly decrease the amount of pain that you do have. Your total joint replacement surgery will last for anywhere from 2 to 3 hours. During this time, you will be cared for by a physician, physician assistant, nurses, and skilled scrub technicians. When your surgery is complete, you will be transported to our post-anesthesia care unit, or otherwise known as recovery room. When you wake up, your nurse will be by your side. She will be asking you your level of pain. Pain is important for us to know in the best way to treat you. We'll ask you to rate your pain on a scale of 0 to 10, 0 being no pain, 10 being the worst pain that you've ever had in your life. We need to know the level of pain, where your pain is, the intensity of your pain, and what the pain feels like in order for us to best treat your pain. Also, while you're in recovery, your vital signs will be checked, your dressings will be checked for bleeding and drainage, your circulation will be checked. You'll be asked to do an incentive spirometer, which will be shown to you in the pre-op area. The purpose of the incentive spirometer is to expand your lungs to help prevent pneumonia. You also will be sent home with the incentive spirometer and given instructions to use this hourly at home, once at home. Also in the recovery room, when you wake up, you will have compression devices. We call these scuds. These will be wrapped around your calf areas. And you will feel they're connected to a pump, and you will feel the pump squeeze and release pressure on your leg. This helps promote circulation to prevent blood clots. Once awake, you will be able to drink fluids. We also have light snacks available. You can expect to stay with us in our recovery room for a minimum of 2 hours after total joint replacement surgery. Once you are close to discharge time, we will be assisting you with getting out of the bed and walking with your walker with instructions given by either a nurse or a physical therapist. We also will walk with you to the bathroom. You will be required to urinate before discharge time. It is important that you have a driver on the day of your surgery, as well as you will be required to have someone at home available to stay with you for a minimum of 24 hours after surgery. But keep in mind, after total joint replacement surgery, you are likely to need help at home longer than 24 hours. While you are in recovery, we will be treating your pain for you with either IV pain medications and then working toward getting you on your oral narcotic pain medication prescription that you'll be going home with. It is unrealistic to think that you will be waking up without any pain at all after total joint replacement surgery, but just know that we will be treating your pain while you are with us, and your pain will be manageable and tolerable before the time of discharge. For your post-op appointments, follow-up appointments, physical therapy appointments, you will need to arrange for someone to drive you. Your surgeon will let you know when it is safe for you to drive again. Absolutely, you may not drive until you have finished all of your narcotic pain medication use. While your family member or caregiver is here on the day of surgery waiting, they at some point in time will be called inside to review discharge instructions with a discharge nurse. All of these instructions will be written and be sent home with you. It's a good idea for you to review these once you're home or the day after surgery. These instructions will include instructions for medications, including your pain medications at home. It will include instructions for your incision and your dressing care, your wound care. It will be instructions to help manage your swelling and using ice where necessary. Also, these instructions will also include your home exercises that you will be doing at home along with physical therapy. A lot of our patients like to get brave the first few days after surgery. They think they can take a few steps without a walker. I would encourage you to not do that. It's extremely important that you use your walker until your physical therapist or your surgeon tells you that you no longer need the use of your walker. Also, physical therapy is extremely important after total joint replacement surgery. It is critical for your recovery. Although you may feel significant pain during and after your physical therapy, it is extremely important to continue with the physical therapy for maximum success after the surgery. It is normal to experience significant bruising and swelling after total joint replacement surgery. However, you will be provided with numbers to call. There is a nurse call line that will be available, and the number will be provided to you for questions or problems that should arise. Of course, if you experience chest pain, shortness of breath, or any other emergent situation, you should call 911. There are things that we would like for you to call immediately, though, if you should experience things such as fever of 101, any significant increase in your pain, any bleeding, any drainage, any falls, any pain that is unrelieved by your pain medication, any excessive swelling, or any questions or problems that arise. For any questions or concerns, feel free to call the surgery center or your surgeon's office for questions. Certainly, if there are urgent questions, you will have the on-call nurse phone number provided to you to call as well. From all of us at Bluegrass Specialty Surgery Center, thank you for entrusting us with your care, and we wish you the very best possible outcome from your total joint replacement surgery.